here for our July 1st COVID-19 Task Force meeting. Bridge is not with us. He's doing something else. And Charlie is so far not on the call, but I'm sure he will be shortly. We have minutes from the previous meetings on May 22nd and May 27th. I hope everyone's had a chance to check those out. Are there any, let's do the 22nd first. Are there any corrections or amendments to the May 22nd minutes? Seeing none, do I have a motion to accept those? Pam makes a motion to accept the meetings of the 22nd. Do I have a second? I'll second it. All in favor, raise your hand. Minutes are passed. May 27th, are there any amendments or corrections from the minutes of May 27th? Seeing none, do I have a motion to approve the minutes of May 27th? Somebody move.
I'll motion.
I almost called you Bernie. Buzzy.
No problem.
Buzzy makes a motion to accept. Do I have a second? Pam, all in favor, raise your hand. And that passes. So they're approved. All the minutes are approved. We're going to move right into Matt. Traffic data and any congestion issues or anything from the field that's important for us to know.
So I think the biggest change over since our last meeting 2 weeks ago is we got the with the rule change about masks required on the marginal way. We got the signage in, got the new signage posted. The signs that are up there now are they look a little bit more consistent with the beach rules signs. So it's got more somewhat of a Ogunquit sort of rules theme going. And just this week, staffing has allowed us to be able to begin placing community service officers stationary on the marginal way and informing people. He's currently at the lighthouse, so that's where we've had him based on Israel Head and Stearns about the mask rules and offering masks to those who don't have them. The option has been, the masks are required, and if would you like a mask? And if they take a mask, that's fine. And if they decline, then they're asked to leave the marginal way. Yesterday was the first full day of that rollout, and I believe he gave out 60 something masks. And today, I checked with him just before we got on, and he gave out 40 masks today. So those are fairly significant numbers of people who would otherwise be unmasked. And we think that physical presence on the marginal way, basically in the middle, is going to make somewhat of a difference for both compliance and the number of people who are wearing the masks. We were busy. We had talked about at the end of the last meeting, we were coming upon a stretch of a heat wave, so weather in the 90s for a stretch of time that included that one weekend. So we were fairly busy with crowds. Again, I think people, except for the ramp area of the main beach, are really doing a good job of walking further down the beach and isolating themselves in their clusters and distancing out. I would say people are doing a better job this year of using more of the sand. We've been trying to push out way more visible information about tides on our signage and on some of our postings, because as we all know, the beach is very different high tide to low tide. So I think we have some good compliance with distancing on the beach. Probably not a lot. There aren't a ton of people in their groups wearing masks. But what we've noticed and our observations are that when they leave their area or they're leaving the beach or coming onto the beach, a lot of them are putting on masks when they're transiting through the crowds and up through the parking lot. And we're seeing quite frankly, the same thing on the marginal way, which is people will pull down their masks, and when they approach someone, they're pulling their masks back up. So those are some of the activities that we're seeing, and I think overall we're seeing an increase in mask awareness. I still, obviously, it's not perfect, and I don't think we'll ever be perfect, but I think our numbers of people who are wearing masks are increasing. I think the data over the last couple of weeks that you're seeing from the federal level on down really points to masks being maybe the key or a key to helping control the spread. So I think that's helping. We still, I would say, and maybe Buzz, you can speak to this too, but still at night, it's a different world. Downtown, even though some of the establishments, more of the establishments are opening back up, there's limited numbers, limited seating, and some limited options as far as what they're allowed. And we're really quieting down, say 9 or 10 o'clock in the evening time. And the crowds are going away. We used to say basically there were two different cycles in the summertime in Ogunquit. You had the 8 to 11 beach rush when people would go to the beach, and the town's packed with people looking for parking spots. And on the beach, you'd have people leave as the afternoon wore on, and then you'd have a dinner rush, and then around 9 or 10 o'clock at night, you'd have the nightlife rush that lasted until 2:30 in the morning in that time frame. And we're not seeing that nighttime crowd still. We had talked about using my own drone to take some still shots when it was busy, and we encountered some aeronautical issues. It wouldn't fly, so we weren't able to do that. But we'll see if we can work on that and troubleshoot that for more data or more things for Kent to analyze. We did give Kent, who I know isn't here today, but we did give him a rather large data dump of traffic data from 3 or 4 traffic counters that we had. So I'm sure that he'll be busy trying to make some kind of sense of that. Other than that, that's pretty much what I have, unless you guys have any questions.
Thank you, Matt. Are there any questions for Matt? Pam?
I just have one question for you, Matt, Pam. With the town getting the new Keep Maine Healthy grant, will have the opportunity to hire more CSOs. Will your plan include putting more than one CSO along the marginal way?
Likely, yes. So we are attempting to hire additional CSOs as part of that grant. Our optimally, we, depending on the weather and stuff, we're going to vary staffing somewhat. So for example, a lot of today or yesterday wasn't a great beach day, but people still walk the marginal way. So we would then flow more staff towards the marginal way. But I think depending on what kind of restrictions we come up with, or what the activity is like in other beaches, North Beach, Footbridge Beach, it's likely that we might put more than one person on the marginal way because that's been certainly an area where we know we need to focus on mask compliance.
Thank you.
Okay, thank you, Matt. Appreciate it as always. Next, we have Charlie with any MCDC updates, and you also have, hello, Charlie, there you are.
I'm sorry, Bob. I had one other question for Matt. I had my hand up, but I was
I'm
muted.
sorry.
How many CSOs do we have currently, Matt?
So right now we have, there's 8 CSOs on staff, and we're looking to hire 4 more. And we have 1.5 reserve police officers. The half is a full-time police officer who is limited availability to us on a part-time basis.
Pam,
Just a quick follow-up on that. I know the grant says that you can that they actually put in to hire 8 more CSOs. So,
Some of those, Pam, are already weworking for us. So some of those already started very early last
yeah,
week.
there's 7 in the budget, and there was an additional 8 in the grant.
Yeah, so some of those are on staff and already, but I believe we'll have a total of 12 is our shooting point right now, but I can double check
Okay.
those, Pam.
Thank you very much.
okay, Charlie, come back. There's Charlie. Charlie, you're on mute.
Okay, I had a question for Matt too, before I start. Matt, do they give out masks just at Marginal Way, or do they give them at the entrance to the beach or in the nighttime, like you had mentioned it? A lot of people in close proximity, now that the bars can open.
Bars can't open. Bars cannot open, but
Are they open as of today, Matt?
no, that was delayed with no date set by the governor. But we're giving out masks wherever we have staff. Visitor Services is giving out masks in the parking lots. Our police officers and our community service officers, as well as our reserve officers, are stocked with masks on their persons. And anytime they encounter someone in a situation where a mask should be worn or is necessary or might be needed, they're offering them masks. So we are offering everyone, everywhere, masks.
Great. I thought that was the case, but it just sounded like Marginal Way when I was just listening. So I wanted to clarify that. Thank you.
You're welcome.
Okay, so for my main CDC report, before I turn it over to Eric Fogg from York Hospital, there's new development today, and probably a lot of you already know, Connecticut, New Jersey, and New York are also not required. People coming from those 3 states are no longer required. I guess it's as of this Friday, now that I look at it, on the 3rd. They, along with New Hampshire and Vermont, those 5 states, are not required to test. So they can come and vacation with us. Also, the governor spoke and that was the governor who spoke at first, and then she turned it over to Near Shaw, the main epidemiologist. She also told us that Governor Mills also told us that we're the 7th lowest in positivity rates in the state. Maine has the 7th lowest positivity rates of all the states. 9th in deaths. It's the 4th highest in recovery. So those are pretty good numbers. Our latest number was 3,294 total cases, of which 2,922 were confirmed. We were up 41 cases today. No new deaths for the last 2 days. And currently there are only 29 people in hospitals, 8 in the ICU and 3 on ventilators. They did 2,268 tests in the last 24 hours. 34 came up positive for a 1.5% positivity rate. In the last 7 days, the positivity rate was just under 2%. And what they found is the alarming thing a little bit was that about half of those people were under 30 years old, which is a whole new kind of a thing. Our total positivity rate at this time is 3.85%. Of the 96,610 PCR tests that they've done, the positivity rate comes to about 3.85%. There was a slight uptick in the 7-day positivity rates of late. And the reason for the uptick was that more tests were done. That's one of the reasons. The other reason that Dr. Shaw said was that the average age of those tested has gone up for some reason just in the last week or so. So anyway, I'm going to turn it over to Eric Fogg at this point from York Hospital. Thank you for listening.
Good afternoon, everybody. So I am here at our drive-through testing site today, and I'll build on Charlie's numbers. We, let's see here. We just finished June in terms of our drive-through project. 1 month into it, we performed 1,609 tests and had 8 positive in the month of June at our outpatient test. So that's less than 0.5%. Our numbers remain very, very low here in Southern York County and at York Hospital. Our percent positive rate is about 1%. So we're in good shape down here. But today was a big day at the drive-through. We flipped our process here to a rapid testing site. I can't remember where I left this group off a couple weeks ago, but we were contacted by Governor Mills and the state to serve as a gateway testing program for tourists and those of us Mainers who may be returning to the state after a period being away to deploy rapid test. And today at noon, we flipped that switch on, and within minutes, we filled up all of our slots for testing. We performed 40 rapid tests today. A rapid test is an instrument that was manufactured here in Maine through Abbott Laboratories. I think they're out of Scarborough. We have 3 of those instruments here now at the drive-through. So in addition to performing regular swab and send to a lab, we also have the opportunity to do rapid testing here. And again, this is in partnership with the state, and it was a huge success today, and it went incredibly smooth. And I'll be glad to answer any questions about that specifically or anything else related to COVID. I noticed that, and Charlie may have said this, I just jumped on, that Governor Mills just announced that Connecticut, I believe New Jersey and New York can now come to the state of Maine and bypass the quarantine. So 3 more states were added to both New Hampshire and Vermont today. That was announced at 2 o'clock. So that's the deal. There's a question here about a provider's order. With our rapid testing program, Hunt, we don't require an order to be tested through our rapid testing. We're using the state's standing order. I am putting in the chat box right now a link to all of our testing information and how to access our rapid testing program and how to schedule that. So I think everyone can see that. I just shot it out to all the panelists. That's the hyperlink to our updated testing protocol, and hopefully you'll see that as good news here that we've expanded our testing capabilities here at the York facility. Any
Okay,
questions?
thank you, Eric. Are there any questions from the members for Eric?
Yeah, so Barb just said in the chat box, can this be posted? That's live on our website. I literally cut and pasted that right now. So you're welcome to publish that whatever way you can.
I just published that, so
yeah,
it's on.
Perfect.
Rebecca.
Hi, Eric.
Good afternoon.
I read that 743 healthcare workers in Maine have been infected with COVID, including those 4 EMTs up in Holton. Now that number, it's a large number. I assume it includes nursing home staff, but it supposedly represents 25% of all healthcare workers in Maine. Is that something that you've experienced? Do you know about your county?
So we track very closely our numbers here at York Hospital, and we include, there's over 1,200 employees here at York Hospital. We have had 10 positive healthcare workers at York Hospital. We had 5 of those in the second week in March. Our last positive healthcare worker was a month ago. So we've done a tremendous job at keeping that number very, very low. As a matter of fact, we believe 9 out of the 10 of those were acquired in the community and not at work. So we seem to be performing pretty well on protecting and keeping our healthcare workers very safe. So certainly something we're watching closely, and we were a little taken back by that number. And but here at York Hospital, we're doing quite well.
Great, thank you.
You bet. Charlie.
Eric, I'm assuming I'm not muted, so.
You're good.
You're good, Charlie.
You said you become a rapid testing site. I didn't hear you, maybe I missed it. How long would it take somebody to drive up there, get tested and get the results? Because before it was 24 hours. Has it decreased?
The rapid test produce a result in 15 minutes. People actually pull over, wait for the result, and we hand them the result before they drive off. So it's kind of a game changer in many ways in terms of how quickly you can get a test.
Rick?
Amazing.
Yeah.
Thank you, Eric.
You bet.
That's great.
So Eric, the freedom to be able to test anybody is very confusing at this point. Listening to the last couple of times that Dr. Shah was talking, he even said that just because you have the standing order doesn't mean that necessarily you can get a test, depending if the testing site is willing, et cetera. So it's very confusing. And now our numbers are smaller now that it's basically Massachusetts and Pennsylvania that we need to think about who's need to be tested if they can't do it at home. So 40 is not a huge number, but are the other alternatives still there? And again, how far ahead can somebody schedule a test?
Yeah, so
it's 2 questions, I'm sorry.
Yeah, no, I'll take as many. So I'll do the easy one first. So I just set up, and you're welcome to go ahead and play around on our website. That website will then take you to my scheduling platform, and you can schedule indefinitely is kind of the setting I just used. So you could schedule a test for December. Now let's hope we don't need to be testing folks in December, but I've opened up the window that say, hey, I'm coming on vacation the first week of August. My platform now allows you to go ahead and plan ahead and get on my schedule. I do want to clarify, I did say that we did 40 today. That's because we launched it at about 12:31. We got everything stood up. But starting tomorrow, I have approximately 75 slots for the rapid test. The other part of your question was, we still do the traditional test. If someone's physician in, say, Pennsylvania, to your point, sent an order, faxed an order up here to us, and that information, again, how to do that is on the website, we can still do the traditional swab and it gets sent off to the lab and the results come back in 24. So we have the capacity to do about 150 tests a day, which I appreciate your concern about capacity and numbers and the large volume of people coming up here. But please keep in mind, if you go to the Maine CDC website, the governor's initiative to keep Maine healthy, that program has stood up approximately 40 plus testing sites. And my understanding, there's going to be several coming on in York County. Now, I am the only one that will be doing the rapid because I know that's the only instruments that the state had available. They sent us all 3 of them. The other ones are going to be this, what's called a swab and send program, where you swab and you get the results in 24 hours. I understand perhaps the CVS in Wells is participating in this program. I understand Sanford's going to stand up 1, if not 2 of these sites. So those are going to be coming online shortly. So I believe that folks coming into the state will have multiple options besides, I can't lift the whole load to your point, but I think I can do it at least a good chunk of folks on a weekly basis. We're talking close to probably what? Oh, I also went to 7 days a week. If you recall, I was only Monday through Friday. I'm now 7 days a week starting this holiday weekend. So I'm going to be doing close to 800 tests a week. I know that there's a lot more people that come to Maine, but hopefully, you know, with the 5 states now that can bypass, the need goes down.
Thank you.
You bet.
Okay, any other questions for Eric? Alice?
Hi, Eric. Thanks again for being such a great resource. I really appreciate it and how quickly you answer questions and all that. What are your hours? So this is important. We're actually getting ready to send out a visitor newsletter, and I popped this into it. You were Monday through Friday, 8 to 4. So what will the new hours be when you expand testing?
Yeah, I'm going to say them to you, and I'm going to send you them in the text thing. So Monday through Thursday, we're 8 to 4 like we always are. We thought that it might be busier on Fridays, so we're going to go 8 to 6 Friday. Saturday, we're going to do 10 to 6. And then Sunday, we're going to do 10 to 4. So I just put them all there in the chat, so you can we can reproduce those. But we thought we'd try with that. We figured Friday and Saturday might be the busier days with folks coming into the States and whatnot. But those are our hours. Again, that will also be posted on our website. But feel free to include it in your newsletter. We do anticipate that if the demand goes crazy and whatnot, which it may, we want to be nimble with this. And a little flexible. Governor Mills was kind enough to deploy the National Guard to assist us. So this project looks a little bit more beefier. When you pass by, you'll see folks in uniform and stuff helping to support the traffic flow and try to increase our offerings. So those are our new hours.
Great, thank you.
You bet.
All right, any other questions? If not, thank you, Eric. Appreciate you being here and everything you're doing for keeping us healthy.
You bet. And last question, Lauren, before I get off, she just asked, what happens if someone tests positive? You know, that's a spectacular question because we had the same question when the state approached us. We were told this by the state. We have to follow the protocol. The protocol is to advise the state of any positive testing. The patient will be given the result that is positive as well. We won't be calling it because we don't know where they're going per se. They don't necessarily disclose that. So we're relying on the patient to then sign their declaration honestly, I guess, and relying on them to the honor code and whatnot. But our obligation is to inform the Maine CDC. We do have the demographics that we collect in order for them to be swabbed. So all their contact information will be produced. And so our obligation is to notify the state of the positive test, and it stops there. We do give information about what it means to be positive and what you should do from a medical standpoint in terms of quarantining yourself and not, staying home, basically. So that's what we've been instructed to do by the state and our legal team here at the hospital.
Okay, thank you, Eric.
You bet. Have a great day, everybody, and reach out if you need anything.
Okay,
Thanks,
thank you.
Eric.
Yep.
Okay, I added a section here for Rick. Rick has been diligently and effectively responding to inquiries that come into the website from all sources, and I appreciate his effort on that. And so he has some time here now to kind of give us a review of what he's been seeing and what he's been saying. So Rick, please.
The email that we get through the COVID task force, and we all see the email, so we all know what the questions are. but I can share that a lot of the questions initially when it first opened up were, when is the marginal way going to open? When is the beach going to open? When can I see this? When can I do that? And those are factual questions, and a lot of it. Initially, we didn't even know the answer to most of these questions. It was just at that point it was unknown. Once we knew, then we could provide that answer, and then it started getting to becoming more questions about when are you going to lift the quarantine? When are you going to stop that? And and those questions were referred to the governor's page. We got a lot of questions on people asking if they can come if they're not from Maine or New Hampshire, Vermont, and those people I referred to the governor's page to look at. This is what is expected of people who are not from here. We do also get a few, probably a half dozen to a dozen questions or statements of people providing information about what they've seen. People not wearing masks, people concerned about. There was never any specific businesses or any specific businesses mentioned or concerns, but there were questions about what. Why somebody's not wearing a mask on the marginal way. I only saw this many percentage. People who were, for all intents and purposes, being helpful with their information because they were concerned about safety. And with a lot of those questions or those emails, I would forward them on to Matt so that he would have the information. He could pass it on to the CSOs or whoever needed to know that information. And then we also have gotten a few questions of people saying, I'm not sure if I should come or not because I'm not sure what's the beach like, what are the streets like, and I was very honest with the people, and I said, we are doing the best. People are doing a very good job of following the rules. The restaurants are doing a fantastic job of following what the procedures that are put in front of them by the CDC, and as far as people wearing masks on the marginal way and on the beach being separated, I said, honestly, we're dealing with human nature. So we are educating them as much as we can. We are following up with that. And people are being as safe as they can. And if you're comfortable, we can't basically would say, I can't make that decision for you. I would love to make that decision for you, but you need to make the decision that you're most comfortable with. And actually, I got an email back from one of those folks who thanked me for my honesty and forthrightness about that, because it really was, it's I can't make that decision. Just like any of us, we make the decision whether or not we're going to walk on the beach, whether we're going to walk through town. And I think also people who come here every year don't realize that at this moment, the crowds are not the same. The congestion is not the same as what we're used to. And some of that has to do with people being concerned. Some of it has to do with Canadians not being able to come down right now. And happy Canada Day, by the way, Rebecca. So I think for the most part, the emails have been pretty appropriate for what the questions that people ask. We've gotten a few that are just completely from left field, and we've just said, thank you very much. This is not the appropriate place for that question. So, thanks.
Thank you, Rick. Appreciate that, and appreciate you taking up that task and role. Rebecca?
Thank you for doing all that, Rick. I was wondering if you got forwarded that one by the woman visitor who left early because she was in a restaurant and you had to pass the bar to go to the bathroom and to exit.
No, I never saw that one.
Maybe Matt knows about that.
I did not see that one either.
I did see it, and I thought when I do my report, I would talk a little bit about it. That makes sense.
And if it lists a specific business of a concern, feel free to send it to us offline, and we've gotten several concerns or questions about specific restaurants that we look into and we address on an individual basis.
Charlie? Charlie, you're on mute
And he's frozen.
and you're frozen.
Part of the discussion today with the governor, one of the reporters asked her about, is it lawful to require patrons to wear face coverings? And she answered in the positive that she said that she thought it was, and that they support that. And because of the fact that it keeps, others safe as well as yourself. So that might have something to bear with this. And I don't know, maybe Terry Ann's going to talk about that as well, but I just want to bring that up, that there was quite a discussion about it at one point, and the governor did say that her opinion was that they support masks, and they support businesses that require masks.
She said, she used Buzzy's analogy. She said, no shirts, no shoes, no mask, no service. It was kind of her.
She did, yeah.
Her kind of. I thought, oh, Buzzy, they're using your analogy. That's very cool. Anyway.
So how do you eat when you're in a restaurant and you have to wear a mask?
Well, she said just going in and out, not while you're sitting. Once you're okay is how it was presented, as I recall.
All right. Okay, any other comments regarding Rick's presentation? If not, we'll move on to group sub-reports and Rebecca, data. Kent isn't here, so you have the floor.
Thank you. I just have one piece of data, and then I was just going to go through summarizing some of the facts that we do know about COVID, and also just some remarks that Dr. Shaw made that I thought were pretty wonderful. Almost 28% of COVID cases in Maine were in the Black community, and they only represent 1.4% of the population of Maine. So they have been affected very disproportionately. The good news is that there's only been one death of a Black person in Maine. So I think this speaks to the fact that many of these people are service industry workers. They're probably younger, they don't get as sick, but it's something to remember about all the workers in town, the grocery store people, that we want to keep them safe too. Just to summarize some of the facts about COVID, we know you only need to have 8 to 14 minutes of exposure to get infected. By wearing a mask, you're primarily protecting others, not yourself. You are only protected if others do the same. Flu is more contagious when you feel the worst, but COVID is more contagious the day before or during the early onset of symptoms. If everyone wore a mask, we'd have more freedom to go out. The better we do on public health, the better the economy will do. Contacts need to be found within 3 days of an exposure to have an effect on transmission. COVID spreads easier in dense households. People without symptoms may only have immunity for 3 months. They're finding that antibody levels have been shown to drop 15% in people who are sick, but more than 40% in people who don't have symptoms. Getting infected while getting seriously ill may be related to your own personal risk factors. Getting infected may be more related to circumstances than your own personal biology. Some comments that Dr. Shaw made on June 21st that I thought were really wonderful. He outlined 5 reasons to wear a mask. Number 1, it's scientifically demonstrated to make a difference. Number 2, it's a sign of respect. Number 3, it's an appeal to a sense of community. Number 4, it's a sign of humility. And number 5, it's kind. And this morning I heard a news reporter who is from Oakland, California, and I thought this was an amazing quote. We're only as safe as the people who take the least precautions. That's it for me. Thank you.
Okay, thank you. Any questions or comments for subgroup data?
I've got a little something.
Oh.
So,
Charlie, you're frozen, so I
had a
can't really
little-
see you. Charlie?
can you hear
you're
me
frozen
now?
on my computer. I can hear you, but you're frozen.
All right, well,
Okay.
that's okay.
Go ahead.
I looked at it that way. Oh, the, what I found out was, listening to Dr. Shaw today, which I didn't know, was they were only getting about a 60% response rate from the contact testing in Massachusetts. And Dr. Shaw said we're getting around 90% response rate from our contact tracing, which kind of shocked me. I mean, that's a big difference, 30%. And 60% response rate isn't that great if, you know, especially if somebody has it. I certainly, you know, the CDC, if they contacted me, and I'm just shocked that that's all they're getting in Mass. I don't know if anybody else heard that or anybody else knows numbers about and the response rate. Anybody else has heard anything about that?
Okay, thank you, Charlie. Terry Ann.
I'm going to start the public health part. Then Terry will go. It's going to be very brief here. One, Rick, just to add on, you said the Canadian, that's the 31st of July, right? The 31st, June 21, the Canadian border, or not July 31st?
July 21.
July 21. Okay, great. And just public health. Here we are. This is it. We've worked all this time. Most of these businesses get ready for these next 8 weeks. And everything you're set, your business should be set. You know, here you go, 4th of July, let the gates go, and the race starts. And so all these practices and all these measures that everyone's taken and us as a town has taken, we're going to see how they pay off. And we'll see how we survive it and how we deal with it. Hopefully all these are the right thing to keep us happy, healthy, safe, which is primary importance. Hopefully the business can salvage some economic relief from the tourism. And other than that, I just, that's it. And I want to just give my time to Terry. Thank you.
Thanks, Buzz. Am I on? Yep. So I was going to share the data from the Marginal Way observation team. Just as a reminder, because you really can't social distance on Marginal Way, there's been an effort that Matt described earlier to really encourage people and provide masks for them to wear face coverings. So in general, over the month of June, the use of Marginal Way by walkers is down on average from the same period of time last year by 63%. The weekend range in 2019 for individuals walking Marginal Way Friday to Sunday was from 5,400 to 10,600, and this year it's been 2,000 to 3,500. And the weekly daily range, that's Monday through Thursday in 2019, was just under 300 on a daily basis to 4,000, and in this year it's been 200 to 800. The observation by the crew of volunteers who have been counting basically indicated that over the past 2 weeks, the number of people wearing masks ranged from 43% to 49%. That they, Joan did share that the CSO who was handing out masks on Marginal Way, people were taking them and putting them on. And as the Chief Pat mentioned last night, there seemed to be, no confrontations. People were taking them and putting them on. We don't know how long they wore them or whether they took them off when they got outside the site of the CSOs, but people took them willingly and were wearing them. What I wanted to just be a broken record about wearing masks. Becky gave us a really good overview, and we learned a lot from the AIDS epidemic when we tried really hard to get people to take personal actions to protect themselves and others from spread of the disease. And we're doing the same now, but it takes a lot of time. And thinking about what we learned, what were the lessons learned to get people to take those protective actions was how do we cajole, not compel? And so what else can we do to up the number of people who are using masks? And some of this is local because this is all we really can control. We know that shaming doesn't work. If we continue to, as Matt talked about today, make our messaging less confusing and more consistent, that's going to help. And with the additional dollars we got, there may be some other materials that we can develop other than signs. I know that the chamber is engaging with the town in trying to make these measures a community-wide effort. And I'm really pleased that they're going to do that because it does need to be community-wide, businesses and citizens together, as well as visitors. It really gives us an opportunity to say, come to Ogunquit. It's a safe place to come because we're really having success with our protective measures and people engaging in them. One of the challenging things, I think, for all of us, and I have friends and acquaintances on both sides, unfortunately, wearing masks because we have no national policy has really become somewhat of a political hot button with sort of the balance between personal and individual freedom versus collective good. And there are going to be some people that no matter what we do will be convinced to do it, but there are others for whom it's just uncomfortable. They don't like to wear them, but could become diligent mask wearers. I don't know if any of you see any of you use Facebook, you would see all the different masks now that are available, some of which are attractive, they're more comfortable, they're easier to breathe through. Those are all reasons people don't like to do it, but the more we can do and the more businesses do to make choices available, the better off we'll be. Also, a range of options, not just masks, but a range of options like some of the face coverings. I've been out to a couple of places recently and I saw customers with the not masks, but the plastic face coverings. And the other thing is dispense masks where they're most needed, which we've started to do on Marginal Way and we can do in other places. I did want to mention a couple of positive things. I was on the beach 4 different times over the past week and a half, some at high tide. And I have to say that even at high tide, that people were spaced apart, groups were spaced apart, and it's very consistent with what Matt reported. I think that's been good. But the number one complaint, again, that our emails have mentioned and town officials have mentioned is people's concern about folks not wearing face masks. And I just wanted to tell you one visitor story that was received by, Matt hadn't seen it, but it was on the police department, I think their website, but it was a couple who had come from Maine to spend a weekend in a local hotel. And they were going to stay a couple of nights, and they were very complimentary about all the measures that the hotel had taken. And they went out to dinner and were complimentary about, it was raining, and so they had to go inside. The restaurant had spread tables far apart, and the servers were wearing masks, and they were very complimentary, but became very concerned when they had to go to the restroom, that a part of the restaurant where the bar is located, they described it as having lots of young people shoulder to shoulder with no masks. And they were very concerned about what might happen to those young people. And I thought very compassionate. They, though, because of that, decided to leave town and not stay for a second night because they didn't feel confident that they could remain safe. And, you know, here was an instance where one business affected another business not in a positive way. And that's why it has to really be a community-wide effort, because everything we do affects one another. The other thing I just wanted to end with was, I'm sort of an old public health person, and I always take precautions. I'm very careful, but I have not been personally affected until this past week by the COVID-19 virus. And this past week, childhood friends of my family, their parents both had COVID. They live at home, they live independently. One recovered and the other just died. And their kids, who are my family's friends, one of them has is immune suppressed, and those kids are now self isolating, but we don't know what the impact is going to be on those kids because of their exposure to the virus. So I think for a lot of people, if you haven't been personally affected, it's really hard to, you know, think how important it is to take the measures. We're sick of it. We've all been doing everything we're supposed to do, and it's still there and it's not getting better. So I think we need to have compassion for one another, even those who aren't taking up the cudgel and wearing face coverings as much as we might wish. So that's it. Bye.
Okay, any questions or comments for Terry Ann or Buzzy? If not, we'll move along to at risk, Charlie and Pam.
I'll take a little, Charlie looks like he's frozen again and unmuted. So as far as at risk, we don't have anything specific. At risk today, based on all the data that we're seeing, is not just the people 65 and older or 60 and over, or people who have pre-existing conditions. With the spikes that we're seeing in all the different states, the at risk is all of us. So I echo what Terry said, Becky said, Rick, we all need to be diligent. We all need to educate constantly, to wear a mask, to protect, you're doing it to protect someone else, to wash your hands, to social distance, to do all that. And in the end, that's about the only thing that's going to flatten out the curve. You listen to Dr. Fauci all the time, and he tells you to do this and do this. And I've known Tony for years, and he's right on. So I think that we all need to be diligent. We all need to, when we're talking to people, and people call and ask, you know, what do you think? Should I wear a mask? Shouldn't I wear a mask? You know, and we're all, this task force says the same mantra. It's our job to educate other people so they can continue telling that story everywhere. So it's not, again, just the people in the 60, 65 age and over, or with comorbidities or pre-existing conditions. It's everybody, it's all of us. And especially the younger crowd right now, because though they may not be hospitalized as much and their symptoms may not be as severe, we're seeing a lot of cases. So that's all I have. Thank you.
Thank you, Pam. Charlie, do you have anything to add? Charlie, you're still frozen, so. And you got.
I just want to add to what Pam.
Okay.
Can you hear me now?
You're on.
Can you hear me now, Bob?
I can hear you now.
I just wanted to add to what Pam. That's fine. It's just as well. I just want to reiterate what the last week's findings were in the 2,268 tests they did. As Pam mentioned, almost half of those were under 30 years old of the positives that they found. There were 34 positives in that, and about half of those were under 30. So she's absolutely right. We're all at risk at this point. And, you know, the hand washing, the face coverings, those are things we've been pushing and talking about ever since we started this. And the social distancing, those are still pertinent, and we should continue to let people know that that's the best way you can stay safe and keep your family and friends and the community safe by respecting others and doing that. So I'm really proud of this committee because all of us have been pretty much saying the same thing as we go along. And that's what I'm really proud of. And so thank you very much.
Okay, thank you, Charlie. Any member comments? Seeing none, then we'll move on to Alice.
Okay, a couple of quick things. We are for Becky and Kent had a conversation with several hotels and restaurants in terms of what kind of data we could get for you, in terms of percentages of occupancy versus normal, number of covers at restaurants versus normal. One of our committee members mentioned that like any restaurant that's using a reservation system the last couple of years could easily pull that data for us. And then Rick was on the call, and Rick had suggested that we also ask the restaurants about per check averages. So that's the kind of data that we're collecting to help with the research part of this. We did introduce some new signage. Right previously, our Ogunquit Together signage consisted of 4 different signs: hand washing, wear a mask, social distancing, and then a large poster with all 3 messages. Last week, the Retail Association of Maine came out with another poster that basically was be kind and respect others, with the goal to wear a mask. So we've added that signage to our set of signages as well. in the hope of helping to educate people why it's important to wear a mask. Related to that, I don't know if you guys saw this, it was reported in Maine Biz, and I think the Portland Press Herald picked it up, but the Southern Mid-State Chamber did an exhaustive study on consumer attitudes about masks and social distancing. And if you haven't seen it, I'll be glad to send you the executive summary and the summary. I did send it along to Scott Hyland and to Pat Finnegan, and I'll explain why in a minute. But that data is available as well. So I'll definitely get that at least to Rebecca and to Kent. And if anybody else is interested, I'd be happy to send that along as well. During one of our conversations too, it was interesting that restaurants were talking about reinforcing the reason to wear masks and things like that. And that, one of our restaurant owners, who is not shy, to say the least, basically said it would be so nice to have someone else have to enforce the rules. And then one of our hotel owners, who employs a lot of teenagers, said it's extremely hard for teenagers to tell an adult patron to put a mask on because the adults won't listen to them. So I think the addition of the extra CSOs and the ambassadors that the town will be adding is going to be very, very helpful, because our businesses have, like I said, there definitely is a desire among some of our businesses to be able to have that enforcement from someone outside the business. So I think that is something that we can work with the community on, with the town government on as well. We've also developed a system for complaints. We were receiving a number of calls about a specific business in town where we were being told by visitors that the employees weren't wearing masks, they were offering food samples, and they were actually actively telling their customers that they didn't have to wear masks when they came into the store. This particular business is not a chamber member. If it were a chamber member, we would have made a phone call in order to give them some educational information and ask them to, behave in a responsible manner. So I talked to Pat Finnegan about it. And so we've kind of set up a system where if the chamber receives any complaints, that we'll get in touch with town, and Pat will channel it accordingly, most likely to Scott, I would think, in terms of just getting in touch with the business and helping to educate them about the importance of operating in a safe manner. And I think that's about it. I did, at Pam's suggestion, add all of our task force members to our COVID-19 newsletter list. So anytime we send out something about COVID-19, you all will be getting it. I've been pulling together information since last Thursday or Friday. I basically try to collect it and try to send it out once a week. But then when there's an announcement like today, it's kind of nice that I've got it all kind of in one place, and it just needs to be formatted nicely. We can send it out with the headline about, Connecticut, New York, and New Jersey, which I'm sure most of our members will be familiar with by the time they get the email tonight. But there's a lot of other data in that as well that we curate from all the different newsletters we get. So you guys are all added to that list. So thank you, Pam, for that suggestion. And Rick, I don't know if you have anything you want to add, or Buzzy, but that's kind of the view of what's been going on here at the chamber for the last week or so.
Okay, are there any comments or questions? Rebecca?
I don't know whether this is a question for you or for Matt or for Scott, but how does it work when you have a bar in your restaurant? I mean, if you're already limiting the tables, then you may have people that wait at the bar. Do you have to limit the number of seats at how does that work?
Yeah, as far as I know, you need to have, if you have bar stools still out, they need to be 6 feet apart.
Uh-huh.
And I know, like Anchorage, for instance, I know we were at Surf Point 360 last Sunday for my son's 21st birthday, and their upstairs bar isn't even open. It's just open for service. So we were sitting outside and they were just using it as a service bar. So I'm not sure what exactly, but spacing close together is strictly frowned upon. And right now, if you only have a bar, you're only allowed to serve outside. There's no indoor bars or tasting rooms at this point in time.
Right. Thanks.
And also with the bar, there's no standing. Everybody has to be seated, and they don't have to wear a mask when they're seated, but they do have to wear a mask if they get up to go someplace. Mm-hmm. The same thing with the non-food, like with Main Street. Everybody has to be seated, and they can only allow, I believe it's 30 people, I think, on each section of each room of their outdoor space. So like in the case where the restaurant, where people would wait for a table, they're not allowed to now. They can go sit at the bar and eat if they're separate distance, but there is no standing at the bar waiting for a table. You'd have to wait outside or wait till you get a text from the restaurant that your table is ready.
And have there been lines outside that you've noticed so far?
I have not seen any at the restaurants at this point because they don't really want people to wait in line because they either have a reservation or if the tables are open, they'll let them sit right down. But if they don't have a reservation, they can't wait for a table because it's all set up right now to avoid exactly what we're talking about.
Hmm. Thanks.
Pam, and then Alice wants to ask Alice a question.
No, I was just gonna say to Becky, I have not, I've eaten a couple times out, not much, but just about everybody is asking that you call for a reservation first, so that you aren't waiting on the sidewalk, so.
Alice?
Yeah, I was just going to say, I saw something come into the chat room about people signing a pledge to operate safely. And our Ogunquit Together program, which is open to chamber members and non-chamber members, it's open to any business in the community, that we asked them to sign a 3-point commitment. And the first is that they're operating in accordance with DECD guidelines for safe operation, that they're going to request that their patrons wear a mask and that they will practice social distancing in their establishments. So in order to have any of that signage that I was referring to, they have to sign that commitment. And we have about 95 businesses in town that have signed that commitment so far. And we actually are actively promoting that in our visitor newsletter because we feel it's really important for people to know that Ogunquit is doing everything they can to provide a safe environment for their vacation. So that safety message is super, super important.
Thank you, Alice. Any other comments? I have a comment, Alice. So when we were originally charged with our mission, the mission was that the chamber would work through the task force. Clearly, and I'm not criticizing, I'm just suggesting that we have changed our mission and the chamber doesn't work through the task force anymore. It works directly with the town, which I think is fine. It's more effective, more efficient. You received a grant, which is great. So you're going to get some money out of it. And the town got a grant through some work. I think when we assign people to the task force, when the select board assigned people to the task force, they made sure that 3 people represented the chamber. Well, the chamber now works directly with the town and the town manager. I'm wondering what our position is as a task force with regard to the chamber. So if the chamber is going to go over the town directly, there's really no reason for us to be involved in the business part of COVID-19 because we don't have that role because we've now shifted the role on a more one-on-one direct basis. I mean, in the last 2 weeks, a lot has occurred and I knew nothing about it. I think most people on this task force knew nothing about it. One day I woke up and we had $233,000. Nobody at the town bothered to check with us or talk to us or even take our input, but they did contact the chamber. So, and I don't, trust me, no problem for me. I don't really care. I just want to make sure that our processes and the way we operate are consistent with the charge that was given to us. If the charge is different now, so be it. That probably frees us up to do whatever we want to do on other things. But I feel, honestly, I feel a little concerned that in the last 2 weeks, we decided to take 1 week off. All of a sudden now, I watched that meeting last night. And I read the documents, the application, and then, we need this for the chamber, and the chamber's doing this, and the chamber provided this input. That one, I just didn't quite understand it all, but I understand that if it's more effective and more efficient and provides a better opportunity for safety and security and economic viability on a more direct basis with the town, so be it. And it's not just you, the chamber. If we're gonna use this $250,000 for enforcement through more CSOs and more education, what's going to be our role really? I mean, we can sit here and we can all talk about what we feel, what we see, what we learn, what we hear, and then there's 40 people watching us. I mean, okay, that's nice, but that's not really that effective in disseminating the information. There's much more ways, better ways to disseminate this information that will cover a far greater audience. So when we were tasked at the outset, it was try to get the town to reopen on a safe and phased approach. Very difficult task. And you can tell when the decisions were tough, there were 400 people viewing our meetings. Today we have 40. And the decisions we made, and I think we made them in a good way. I think we made them with as much consensus as possible. I think it was nonpartisan. I think all those things occurred. But now we're just kind of like, okay, so business now moves direct, which is good. I'm not saying it's bad. I'm just telling you that's the way it is. We're just kind of like now anecdotally talking about the things that not unimportant, but just we're anecdotally talking about stuff. Is that what a task force really should be doing? I'm not sure about that. We're not a standing committee. I think at some point, if we dissolve ourselves, we'll have left behind a template for how to conduct business in a fair and nonpartisan way. And I think some other committees and maybe even the boards can look at us at how we conducted business, but we're not a standing committee. There is a finite schedule to all this. So I'm not trying to pick on business, but that kind of started me thinking about all the other things that we're doing. We're a task force, and we're not doing tasks. I don't think we'll walk out of here today with any recommendations yet again. I mean, that's probably 3 meetings in a row. And if we're just going to be informative to the community, fine, but there's better ways to be a mouthpiece to the community. Having a meeting with 40 people listen to us, that's not very good marketing from a person who was in marketing for a while. So I'm just wondering about give you a little time, Alice, to tell us how you feel the process is evolving or morphing and where we should be going.
So I'll address the grant first. That was something that came through very quickly. Pat and I started talking about it. It was available to municipalities. And in reading through the application, because the focus was on public education, so of course I wanted to see if there was anything that the chamber could partner with the town on. And right in the grant application, it did say the towns were allowed to subcontract out to the chamber. So Pat and I talked about that and said, is there an opportunity to work together on this? And so we had to get the information into, I think Pat and I talked on Thursday when we had met on Wednesday, our task force. We got the information to Dave on Monday. He submitted it that day, and the grant was awarded on Friday. So it's very fast track. But that's not an excuse. I take part of blame for not informing you guys as to what was going on because I should have. So that's an oversight on my part. And one of the reasons that I told Pam I would add you all to the email list, because I think that would be a critical piece of communication that I was going to our member businesses that had been not going to you guys. And so, that is one step that we took to better inform the committee. In terms of just member complaint, consumer complaint, it so far has been just that one business. And like I said, if they had been a chamber member, we would have gotten in touch with them. But since they weren't, I just reached out to Pat for, I know you have a code enforcement officer and your grant is going to be making him and his group in charge of this type of thing. So if we receive some communication, what's the right way for us to channel it? Because we're not going to approach a non-member business and be in the enforcement business. That's not what we do. So that's a couple of things that just happened quickly. I think in retrospect, I certainly should have informed everybody about the fact that the town had approached us to work together on this grant, and this is what we were going to be working with the town on. And what did you all think? Just because we didn't have a meeting doesn't mean I couldn't have dropped an email to everybody. So I take that blame on myself, and I'll do a better job on that in the future. For little things like that, I think we really have to go back to the select board. I know we're called the task force, but I think there's a ton of value in having the 4 groups working together so that what we're making represents all of them. And if we were to drop business out of that, I think then we're losing a collective voice that needs to be part of the conversation with public health and vulnerable and data. So, again, I think a good example is, Ken and Becky saying to me, can we get this data from the businesses? And then I turn around to our group of businesses and go, I need stuff from the hotels and restaurants. How can I get that? What do you guys have that I can access for these people? So I think there's still an important role to play. But I'd always look, and I don't have the mission in front of me, but I think a really important role that we play is advisory to the select board. If they need our input, are we the ones to enforce? No, but are we the ones to be out there looking at what's going on in the community and make sure the select board has the opinion of the vulnerable group, the data group, the business group, the public health group, so that they're getting good input from a group of people that are tasked with keeping their pulse on the community and how we're doing. So again, I have to go back to the select board and say, what do we think we should be doing now? That's my personal opinion. I think there's a lot of value in having us as an advisory committee and working with the town to make sure they know what hotspots are. Perhaps go back to the select board and say, this is what we believe our mission is now. And is this still what you need? And this is still what you want? Because we were created by the select board. So I think we need to come to them with a proposal about how our role is evolving. Because clearly the beaches in Margin Way were huge and required a big lift from all of us working together, as did the opening up of private spaces. That required it. I have been very uncomfortable putting together a recommendation without hearing from Terry Ann's group and without hearing from Becky's group and without hearing from Pam's group. We needed that kind of input to make sure it was fair to all. So I think that's an important role that this committee plays as well, or task force, whatever we want to call it. So again, I will do a better job at communicating anything we're doing in the future. I think I've already informed you guys about the signage program. So those sandwich board signs will be going out before the end of the holiday weekend. Basically, I asked Pat where they should go, and she's like, well, wherever you want. But Matt was very helpful, because I thought, well, Matt's going to know a whole lot better where those signs should go than me. So Matt sent me a list of locations that we should consider putting those signs in, and we're working to get those. We had the signs printed up, and we're working to get those out tomorrow or Friday, so they're up before the holiday weekend. And they're just the whole approach of welcome back, we're glad you're here, please keep our community safe, and then the three key messages. So I think that'll make the community a little warmer and more welcoming. We're also working on signage for to hang out in front of our chamber as people are coming into town from Route 1, and then to hang up on the Town Line Motel as people are coming south on Route 1 to again reinforce that we're happy everybody's back. So I'm pretty sure we've talked about that, because that's been in our docket now for about a month that we've been working on that. But like I said, with you guys getting the COVID-19 newsletters we send out, I think that's going to kind of keep everybody in the loop, and also give you an opportunity to get in touch with me with any questions that maybe something you need more information on.
Okay. Thank you, Allison.
Clear it up. I mean, I'd love to hear input from everybody else, but I think there's a lot of value in all of our groups continuing to work together to make sure we're doing what's right for the community as a whole.
Yeah, and I just want you to know, I'm trying to bring up a process point about what we are and where we're going.
Yeah.
I have no problem with the business group going to Pat and getting that done so that the money could get to the town. That was fantastic and great news and worth it. So that started me thinking about what is the process that we are going to go forward with. And so this is not to be critical of you in any way, shape, or form.
No, I didn't take it that way, but it's an important
I've
conversation.
done exactly the same thing.
Yeah.
So, Buzzy, I saw your hand raised.
Yep, now that you're done yelling at Alice.
And she took it very well.
Yeah. No, I just want to say that, Bob, I think this weekend is going to be the first time Ogunquit takes its real temperature. And we'll see what tourism looks like in this COVID season, because this is it. This is the startup. So if we see a very large turnout, how do we react? If we see a small turnout, whatever, we have to be, I think that should be our goal as a task force going forward, is to how do we react to these? How do we react to as when the Canadian border opens up at the latter half of the month? Does that affect us anyway? And then when we see crowds, how do we properly channel critiques and ideas, other like on social media where they're going to start taking pictures of Facebook or whatever of some bar somewhere with a bunch of people, and then you're going to be making fun of everybody. And I think that as long as we stay in the sense that our job is giving the public a venue to come to us, then we'll present and give some ideas to the select board as we go with the idea of the business, the public health, the information, that stuff. we'll be able to have a little more of maybe a recommendation, because I appreciate what you're saying, but June's June. We did our work like everyone does in the spring. Now you're waiting for rain, or you're waiting for the summer. And so when we get to that point, I think it'd be very important, at least for the next couple of weeks, we'd be reactive and have ideas of how to handle a positive or negative response. And what happens if all of a sudden the state comes back and says, we're going back, we're shutting a lot of things down? How do we properly tell people to shut down with someone saying, I was open this way forever, it's not my fault, I have to close? These type of things may have to come up. And as my wife said, keep it brief, Buzzy, you talk too much, I end my time.
Thank you, Buzzy, and thank your wife. I appreciate that. Pam, and then Terry Ann. Pam first, Terry Ann.
I obviously see both sides of the coin here. Alice and I did talk, and I did not know all the stuff that Alice was doing and the education component and everything else, and felt that we needed to be part of that and we needed to know what was going on. People ask us those questions, and if we say we don't know and then it gets out there, we look silly. And I understand where Bob is coming from, because we were tasked by the select board to make recommendations to open the beach, make recommendations to open the marginal way, how to make these areas safe, make recommendations in terms of density, outdoor eating, some things like that. Right now, I kind of am not sure where we're going. Then we talk about Dr. Shaw, we talk about numbers, we talk about that. Well, anybody can listen to him on TV. You can go back and listen to him 3 days from now to what he said today. So it's not like something we have to rehash. If people are really interested in the 40 or so, 50 people that listen to us can do that easily. I think having Eric has been good. It does get a forum out it allows people to know what's going on with the testing. I would like that being a little bit more proactive, and not just us hear about it, that he could possibly even be at the select board meetings or have that being live streamed on the police website. But we don't do enforcement. We don't do education other than educating here when we talk. We don't go into the restaurants and tell the restaurants what to do, or the hotels what to do. We may see someone walking on the marginal way without a mask, and we can say something or call the CSO. The same thing on the beach. I don't know what our mission is. I don't know what we need to do. I think this group has done an awful lot, but at the same time, Terry talks about public health, and if we get up to 70% compliance, et cetera, et cetera. I don't know how we do that. We have, with this grant, they now have the ability to bring on another 8 CSOs. Scott has the ability to bring some people on to answer some of the questions maybe that even Rick's been answering. The chamber is going to take a big lead in communication, which is good because all the businesses in town rely on the chamber. That's where they go to get all their information. I mean, that grant had almost, I don't know, $180,000, $200,000 of personnel, new people that were going to be able to come and help to enforce all the regulations that have been set in place by CDC and the guidelines, and our recommendations also. So I don't know, other than I watched the chat room, you know, whether the lifeguards wear masks or not. Does that take up 2 hours of our time, you know, to make decisions about that? I don't think so. So I'm open to suggestions, but I'm in a quandary.
Thank you, Pam. Terry Ann, you had your hand up next.
Yeah, I mean, we were appointed to be an advisory committee to the town by the select board. So as our chair, if you have questions about what they would like you to do now, I think that's a conversation either you or all of us ought to have with the select board. The second thing I would say is we have made a series of recommendations most of them were embodied in the grant award, or because I didn't see the proposal, but most of the things we've been recommending, so we had a lot of input to what the grant was able to put forth and get funded for. So I do understand, I definitely agree with Buzzy that, you know, we've given all we could up till now. Let's see what happens. But I do think there is value in sharing across our various areas of expertise and experience and our networks in a way that can help the town quickly, should they need it, and also to help educate through our networks, not just this meeting, but through our personal and professional and you know, familial networks, to understand what we're learning as we go forward. But I do think this is a conversation, the role to be had with the select board that appointed us. I also would say we've never had to deal with something like COVID-19 ever before. We've never had to deal with the shutdown of our businesses and the closing of our schools. We've never, as a community or a nation, had to deal with that before. So for a vision to have been clear about what our role was and what we ought to do, how would you know, since we've never had to do anything like this before? So that, I think is my perspective. I agree with Alice, I agree with Buzz, and I think that if you think we shouldn't be a task force anymore, I think that discussion should be had with a select board.
Okay, thank you, Carrie Ann. I haven't said that we shouldn't be a task force. I want to know, I just want us to understand what we're here for. That's what I'm trying to gain from this conversation. But I do appreciate all comments, and we will evolve one way or another into something that is beneficial. It is beneficial. I reiterate my statement that our task force, I think, is a template of how to work together in this town. Keep in mind, I know nothing about this town. I know nothing about the politics of this town, although I'm starting to learn it. And it's been quite divisive, apparently. I don't think I'm speaking out of turn by saying that. I don't like militancy and I don't like divisiveness. At some point, we all have to find a way to work together. And I think we are finding that way. And I don't think it's bad, again, that the business community went directly to the town. I think they did a great job of getting a large sum of money to help fight this disease. So that's not my point at all. I want to be an effective group, and I'm searching for ways to be more effective whenever I'm thinking about this organization, which is often. So I appreciate, Terry, on your comments. Perhaps the select board, well, again, if we don't have recommendations, I usually don't get invited to the select board, but maybe I can have some offline with them. There must be some process I can get some more direction from them. So Charlie, is your hand up? Or Charlie, you're frozen with your hand up. Now, I don't know if that's from 10 minutes ago or 10 seconds ago. Charlie, now you're gone completely. You've evaporated. There you are, Charlie. Charlie. Matt, where's Charlie?
He has no bandwidth, I would say. He's technically here, but not here.
Oh, that happens to me a lot. I'm technically here, but not here.
Maybe we can that grant money.
Or I'm technically not here enough. So Charlie, why don't you come back on and just come on and voice? because voice will use lot less bandwidth, obviously. Okay, we'll let Charlie come back because I will reserve some time for Charlie. All right. Oh, I hear him now. No, now you're muted, Charlie. I can't see you, which is probably good, but now you're muted.
Muted. Muted. Hear me now?
You sound like Peter Frampton back in 1976 is what I recall.
What?
That's a good one, right?
I think he needs to dial into AOL one more time.
Yeah, I think his acoustics aren't working. In the
That's a good
meantime,
one.
Charlie's trying to get in, can I ask Matt a question, please?
You may ask Matt a question while Charlie's trying to get on.
Matt, how has this task force been helpful to you, the police department, CSOs, et cetera?
Your task force for us and for myself, the chief, has been quite frankly invaluable. Not only the recommendations that you've made, but the wide variety of opinions and backgrounds that you bring to the table, as well as each of your own individual constituencies that you have. You're bringing all of those viewpoints to us in meetings. You have helped direct our CSO staffs, helped us build a schedule without maybe knowing it, but by identifying areas of concern that you have noted. You coordinated the counts of masks on the marginal way, which is now because of this task force where we're heavily focusing our education/enforcement efforts. You essentially crafted the rules for the marginal way with the marginal way committee. You had Joan on. I think your input has helped tremendously, and my hope is that we'll continue to have your input. My 2 cents sort of is that a lot of the things that are now in flux aren't within our control. They're the rules that the state is setting for us. So unlike originally when, like you stated earlier, the big marginal way beach decisions were huge and obviously of a lot of interest, but there's still a lot of unknowns and a lot of variables. And Buzzy said it really well when this would be a good weekend to take the temperature of the town. And next week or whenever we meet again, we're going to have a lot more of a sense of what the summer is going to look like. There's a lot more people who can now come to town based upon the governor's announcement as of Friday, that there's a huge population center which now can come to town or come to Maine without quarantining or worrying about a test. So we're going to probably end up having to have discussions about lines forming outside of businesses and people queuing up and things like that. And I think the input that we've gotten from watching you folks and reporting back to the select board really for us has been our main tool of how we've scheduled, staffed, worked on enforcement efforts, talked to Dave Riccio about the grant application. All that personnel that's coming on board for that is being used to enforce or educate the rules and the guidelines that you all came up with. So that's a really long way of saying, I think you guys have done an awesome job and we appreciate everything that you've brought to the table, and we hope that you continue to do so.
Thanks, Matt, even though I yelled at you, I think at one of our first meetings.
That's okay. I'm used to it.
I know. Thank you very much.
We had Charlie, but Charlie's missing, but Becky has her hand up. Not Charlie's, but Becky, you go. And then Charlie, hang in there. We're getting to you, buddy.
I don't ever see us replacing any kind of role of town staff. So I think when there's direct communication with the town manager or they're submitting a grant in 5 days' time, that really, it's not like we're excluded from anything, but I think I would like, particularly if we're not meeting, if we have a 2 weeks or 2 or 3 week stretch when we're not meeting, I think I would like a little bit more communication amongst us when something's happening, particularly if people are representing us or there is the perception that they're representing the group. I'd like to know a little bit more about it. I really do like our structure a lot. We're not elected. We haven't had 6 to 5 votes or 5 to 4 votes. We have long discussions, it's true, but we seem to be able to decide things based on consensus, and I hope we continue to be able to do that. And the third thing is, I would be completely happy if we have nothing to do for the rest of the summer. I fear that won't be true, like Buzzy, but that would be a really good thing. I would be very happy to meet every 3 weeks and say that Maine is great and Canada can come and it's all good. The Northeast is doing well. So I think that's our job. And if we don't have any more to do in terms of the Marginal Way or the beach or the Cove, that would be terrific. I suspect it's not going to be that easy, but that would be a successful task force if that happened.
Thank you, Becky. Charlie, can you hear me? Charlie? Your name is in the lights on my screen. There you are. No, Charlie. What?
Can you hear me now?
No. Can't hear you, Charlie. Oh, I have a great joke, but I can't say it. It's not a bad joke, but it's a bit political. But anyway, Charlie?
Charlie, you could actually write whatever you're thinking in your chat.
You can write it in the chat.
Okay, thanks.
Rick will say it. All right. Okay.
Charlie, you can call in the phone number, Charlie. If you dial the phone number, you can call in and I'll put you on the panel.
All right. That's okay. Give me the number.
You gotta look it up.
Okay.
It's a pearl of wisdom that is just immense that we're waiting for this much for Charlie. I mean, you better come up with a cure to cancer. I want some real help here, Skin. Like, it better not be something I can read in the Portland Press Herald. Okay, just telling you. I love you. I'm just telling you.
All right.
Hey, we want it, what we actually want is the vaccine tomorrow, so.
Hey. My colleagues made a nice announcement today. I don't know if anyone saw it. Hello, Charlie. Now you're frozen, but it's a beautiful picture. When you win the U.S. Senior Open, that should be the picture they use.
Should we go to public comment and then come back to Charlie? Maybe he
Probably a
could.
good idea, Terry. Thank you. Charlie, you work on the bandwidth, and let's. Is there anybody, Matt, with their hand raised?
There is not currently anyone with their hand raised. Whoop, nope, someone just raised their hand. Hold on. Michael Scambati. Michael, if you unmute, you should be allowed to talk.
Thank you so much, and good afternoon, everybody. First and foremost, I was thrilled to watch the meeting last night and find out that our town is getting the Keep Maine Healthy grant. That's incredible, especially when we look at how much money will be given versus Wells and York. And Alice, I hope that your team can help position that with the public as a great thing that we're doing to keep us safe and develop some great messaging around this is why you should be coming here, because we're engaged, we're all on the same page, and we're moving forward on the same page. Along those lines, I've got a quick question. I'm not sure if this is for Matt or whether this would be for our code enforcement officer, our CSO, our group. I'm not even sure who can answer this. But are we operating on a if you see something, say something approach? So if we listen to Terry Ann and what happened in the restaurant, two people walked by the bar. There was people sitting crowded around the bar. Nobody had face masks on. It was indoors. So are we depending on people to actually pick up the phone and report things, or are we actually proactively looking? If people are walking along the sidewalk and there's merchandise that's right out to the sidewalk, and we got people that are stopping, looking, and other people can't get by unless they go on the road, are we waiting for people to actually call in and complain, or are we proactively approaching this, whether it's a CSO, code enforcement, Matt, whether it's you and your group? And the other thing is, I've been to the beach a couple times, and there's a lot of what we call stop and drop in front of the Norseman. And when the tide is in, there had to be at least 100, 150 people sitting almost on top of each other in front of the Norseman. So Matt, if you go by that, or a CSO goes by that, what is the responsibility to stop and try to make that better? Do we do anything? Do we just report it? Do we keep record of it? So I guess that's my long drawn out question. Is it, if you see something, say something, or are we going to proactively approach this and try to get ahead of it? Because I think if we're looking for the public to actually keep calling in and making their concerns known, I don't know if that's the best way to do it. Thanks.
If we observe any kind of issue, safety issue, as far as things too far out on the sidewalk for people to safely walk by, groups congregating that are obviously not family groups or people who came together, then we take action then and there. If we observe our own violations, we take our own actions. The police do, and the CSOs work under the police department. They do as well. Visitor Services is offering masks proactively, and if it becomes any kind of a contentious issue, they're notifying us. But as far as if the general public, our preference for the general public would be for them to report issues to us, and I can tell you that they do. And when we get a report of a social distancing mask issue or potentially an overcrowded establishment, we send an officer out to investigate. But as far as individuals, I'd say on an individual basis, if you're a non-enforcement official, then if you see something, say something is the tactic we want to take. But certainly the police department, we take action when we observe any kind of violation, Michael.
Thank you, Matt. Terry Ann?
Pam and Alice might be able to answer this, because I know you've both read the grant, but and I've only skimmed it, but apparently there is funding for proactive outreach and education to businesses, funding for the code enforcement officer and 2 ambassadors to spend their time doing, I think the word they use is proactive outreach. So maybe Pam or Alice could add to Matt's comment.
I did speak with Scott yesterday about that, and he actually wasn't 100% sure what that meant. I think that he has gotten, he said maybe 1 to 3 calls total where people were complaining about businesses not following guidelines. I believe that his intent was to take a look at that and to see if he actually needed anybody, that if more came in, rather than him going out, he would send somebody else. Now, I'm not sure if that's a duplication of services with the CSO. He also said maybe this is something the CSO would do after the complaint would come into him. But I think they're just working stuff out. I'm sure Matt realizes this too, that the grant was just awarded. There was a short period of time. It's that everyone has to take a look with the town to see what they need, what department needs what. I mean, if the land office doesn't need somebody, but Matt needs more people that can act on some of the things that Michael Zambati said, you know, that may be the way going. Again, that's for the town and the town manager to figure out and make the best use of that. This grant is a PPP grant. It's very similar to the other grants that first came out, whereby it ends October the 31st, that the money does need to be accounted for. And if at the end the money has not been spent, the money goes back. So that's about, it's a conditional grant. I
Okay,
think, does that help you?
Mary Ann, does that answer your question? Mary Ann, you're on mute.
No, I just knew that both Pam and Alice have been more involved in the grant and might be able to add to a response to Michael's question. That's all.
Okay, thank you. Matt, anybody else with I saw 2 hands raised. But
Yes,
I don't know what happened to
sorry.
them.
Karen Topchick would like to speak. Karen, go ahead. Karen, you did unmute. Can you hear us? So I think Karen might be having some microphone issues. She is unmuted and allowed to talk. Karen, if you want to chat in your question, I know Bob will definitely address that. As of right at this moment, there are no more raised hands.
Okay.
And
I'm
every
looking
time I
through
say
the
that, someone
chats.
raises their hand and unraised it. I'm sorry. Nope, that's it.
Is there a raised hand?
Yeah, it keeps going up and down. Joan Kramer, I think, would like to speak. Joan, you should be allowed to speak if you unmute.
Okay, sorry about that. It's a little confusing as to whether my hand's up or down. I just wanted to share an observation, and I came in a bit late to this meeting, so you may have already addressed this situation, but a week and a half ago when I was at the Big Beach for the first time, it was a great experience, but I happened to notice that all the Adirondack chairs under the awning were filled with older people, as tends to be the group that I have observed in the past sitting under that nice awning. Not one of them had a mask. The chairs are literally shoulder to shoulder, and it just sort of flies in the face of everything that we've been trying to do to keep the town safe. So maybe there should be no chairs. Maybe they should be, you know, a half as many and spaced, but it just seemed really kind of ludicrous that this was right there in the beginning of our beach, and I couldn't help but worry about those people. So I don't know why the chairs were put out in that manner, I guess, by the town. That's it.
Thank you. I don't have any idea why that is. Maybe anybody else have any ideas? I don't know. I haven't. Pam?
I don't have any ideas, but I know a lot of couples sit there. So if you're a couple, you obviously, and you're together, you don't, but she is absolutely correct. There's a whole line of chairs there. Matt, do the CSOs patrol that area and discuss that at all?
They do patrol that area. I think one of the challenges is determining what is a family group or what is a group that came together versus what isn't. I have been down there often, and I have seen people in the chairs. I haven't personally observed people side to side in a row. I'm sure it does happen, but yes, our CSOs are down there, and if they observed an issue that they were able to identify was clearly a social distancing issue, they would address it, and they offer masks to literally everyone.
Okay.
Also, those Adirondack chairs, I believe, are multiple chairs. They're more benches than chairs, so you can't separate 3 different chairs out. It's, you know, so it's why, I think people need to be responsible for their own behaviors. But if we don't have the chairs there, then there's going to be concerns that there's not chairs and no place for people to sit under cover. So.
Okay.
We had at one point removed all the chairs and benches. But as the beaches have opened back up, and things have become less restrictive as far as congregating in numbers and whatnot, the benches and chairs have gone back.
Okay, so Karen got her chat in, and let's see. Well, I'm going to read it to you. Matt, can you send? Yeah, this came in before too, and you already answered this, but let's answer this now publicly. Can you send a CSO from Israel Head to the Cove, especially with the new grant? Congrats, by the way. Because I have noticed on a regular basis, people are walking without masks. It's really hard to get out of the way since it's so narrow. Also wanted to comment that please do not disband the task force. You guys are the eyes and ears of the town with different perspectives, and my opinion, add a value service to the town. I'm just reading it verbatim. And I truly believe that the grant would not have been issued without the important effort you guys did from day one. Thanks for your efforts. So, and thank you, Karen, for those nice words. CSO from Israel Head to the COA. I think, Matt, you answered that in the chat.
Yes, I did.
Right.
And we will definitely try, and we'll make that one of our priorities for some of our new staff.
Okay. I'm going through the chats because I think sometimes we forget about the chats, and some of them are questions. Here's one from Bruce. Have you considered getting businesses to sign a pledge about maintaining good health procedures? The town can then publish this list as a way of informing visitors. It would be good PROD to businesses who are not doing a good job. Oh, prod, I'm sorry. It would be a good prod. Alice.
So, yeah, I mentioned, I answered that partially before, but so hopefully he heard it. But we do have the Ogunquit Together signage program. Businesses, in order to use that signage, have to sign a 3-part commitment to operate safely. What I didn't see was his question about if there's a list somewhere. But if you go onto the chamber website, there's a link right at the top, just like so many websites where there's a red band at the top that says COVID-19 information. If you click on there, you can click to a list of the participating businesses. And I think we have like 90 or 95 businesses in town up for that. And if anybody else wants to sign up for it, I'd be happy to give them the signage and make them a part of this effort. So spread the word if there's a business that isn't on that list that you think you'd like to see on that list.
Thank you, Alice. I got one here from Bobby Franklin. It says, Bob, if you can remember 1976, you weren't there. And I was also with the 3 other million people at Woodstock. So there you go. That was a good one. God.
There's another hand raised.
Okay.
Steve Duffy would like to speak. Steve, you should be allowed to talk. Steve, if you can hear us, you got to hit unmute. I can't unmute you.
Okay, you hear me now? Can you hear me now?
Yes, we
hear you.
Okay, all right. I don't know if you're seeing the chat that I added a couple of phone numbers for Charlie if you wanted to call in. So the numbers are there. If you can't see that in the chat, 888-788-0099 is the toll-free number. And then there's a regular number. It's 312-626-6799. And that's all I had. Thanks so much.
Thank you, Steve. And Charlie thanks you as well, wherever Charlie is. Oh, there he is.
And Joan Kramer, I think, has her hand up again. Let me unmute her. Joan, did you want to talk again?
Whoops. Yes, I just wanted to make a suggestion back to those Adirondack chairs. it wouldn't be such a bad idea to have a poster that might say these chairs are close together or something, but if you're not part of a family group, please distance, or you could put something on every other seat just to make it clear that we don't want to encourage people to sit literally shoulder to shoulder, particularly without masks. But it just, I don't know. I get it. It's nice to have the shade, but this is an accident waiting to happen, it seems. Thanks.
Okay, thank you. Okay, so let's move on here. Motions for recommendations to the select board. So I think one thing I'd like to talk about in this section is when we meet again. Now, I listened to Buzzy, as I always listen to Buzzy. He makes a good point. There's a big weekend coming up. Do we want to watch our weekend and then meet again next week with the proviso that if all goes well, we can then meet on a 2-week basis from that point? So I throw that out there, not as a motion for the select board, but I think we need to understand what we want to do. So I'll make a motion that we meet next week after this holiday so we can review what transpired. That's a motion. Pam?
I'll second the motion for discussion. You want to meet next Wednesday, correct? Same time, same place?
Yes.
Okay.
So that we can, it's basically a follow-up to what Buzzy said, that, you know, we got a big weekend coming up here. Let's see what happens. And then if we see that all goes well, and, you know, the sense is I think we're doing as a town pretty well. I think the task force has done a great job. I think there's going to be anecdotally issues. That's just the way life works. I think everybody's pulling in the right direction, but let's just see how it goes. And let's see what the outcome of the week. I mean, are we prepared for this? Let's see how it goes, and then meet on Wednesday. And then if we see that it's going well, we go back to every 2 weeks. If not, you know, then we have to figure out, is there something that needs to be done proactively to improve a situation that may have occurred? So, Pam, is that it? You're seconding the motion to meet?
Yes.
Okay. All those in favor to meet next Wednesday, raise your hand. Anybody opposed? No opposition. So the motion carries. Are there anything, I know that the select board wanted us to talk about lifeguards. I'm not prepared to talk about lifeguards because I never talked to any of the lifeguards except for JP briefly. And I think we need to talk to them before we decide to recommend that they do or don't do something. That's their job, and there may be reasons why or why not they're doing certain things. So maybe you know, I know what the select board asked us to do, but it was a little bit vague. That's a job for the task force. Should lifeguards be wearing masks? I don't feel I have enough information nor the expertise to answer that question. If someone else, any former lifeguards here, or someone else has an understanding about that, we can debate it here or discuss it. But I don't see putting a motion together on yes or no until we know more.
I think we need to speak to the lifeguards. We don't know what they've been tasked to do. We don't know if they've been tested. We don't know if they're tested on a regular basis. We know none of this. So to make a motion without any information is, you know, ludicrous at this point. So.
Okay. All right. So let's, anyway, it's a big weekend for them. I don't want to get in their hair
Nope.
for the big weekend. That would be really not too bright. So let's let them keep us safe this weekend. And then we'll take this up after we have some discussions with them. Charlie, unmute yourself. Here we go, buddy.
All right, can you hear me now?
We can hear you.
All right.
T-Mobile, Verizon, Sprint.
No, it's Verizon. I don't know what the heck's wrong with it, you know? And well, anyway, listen, I wanted to just chime in on the situation about how we've operated. And I want to thank you, Bob, because you've done such a great job. And I think part of it has been that, admittedly, you said you don't know that, you just moved here. I think that's part of it. I mean, having been here about 30 years, next year will be my 30th year, actually. I've seen a lot of ups and downs and ins and outs and, you know, a lot of craziness at times, but it's only the few. Most of us really care about this town, and I think that's why this committee has come together. Some people have me in one faction, you know, I don't care whose faction they've got me in. I care mostly about the people in this town and the visitors that come here, and the fact that this town, you know, is a welcoming and good place to live. So that's my only concern. And having said that, I would like to invite more people to get on my age-friendly community committee through the AARP. We are now a sanctioned committee through the town, and all you have to do is apply to the town. So please do so. We've got a handful of people right now. We could use some more. Some of them are very, very qualified. One person who called me said she was the aging in place person for the state of Massachusetts, I believe it was. So we're going to have a great committee. So I'd really love to have it. And as you say, use this as a template for that committee, Bob, because we've worked so well together. And I think that's a lot on you. You've done a great job. And part of it is because I think you don't have any prejudices either way, nor do I. And I think most people don't. And I really am glad that we could be such a big help to the town. So thank you very much. And glad you could listen to me. And I'll shut up now.
Well, thank you, Charlie. If I had known that those words be so kind and directed to me, I would have worked a lot harder to get your broadband fixed. So it's very nice of you, Charlie. I appreciate that. And I appreciate everybody here. We've done, I think we've done a good job so far, and we will continue to do good work. I just feel like it's important to keep the lines of communication open so that we can know what we're all feeling and how we should be moving forward with the tasks at hand. Okay, so having said that, July 4th coming up, big holiday, and I look forward to meeting with everyone next week. Do I have a motion to adjourn?
I'll do that.
Rick has moved to adjourn, and Charlie is seconding it, and so is Buzzy. All in favor, raise your hand. Charlie, say yes.
Yes.
Yes, okay, because we can't see you. All right, so have a safe and healthy, happy weekend, and we'll look forward to seeing you next Wednesday. Same place, same time. Enjoy yourselves.